Good afternoon, everyone. Did you know that undetectable equals untransmittable? My name is Julio Roman, and I am the director of Latinx Gay Bi Initiatives for the Latino Commission on AIDS. And we are so excited to welcome you to today's webinar titled The Power of You Equals You, Choosing Empowerment, Action, and Results in Our Latinx Community. We are so happy that you are able to join us as we empower each other in our Latinx LGBT community by sharing stories and celebrating how we are using this highly effective tool in our HIV prevention toolbox to not only deepen our relationships, but also to keep our communities safe. During today's webinar session, we are going to have a glance overview of the You Equals You movement, its current campaigns, and what the next steps for this movement will be. We're also going to have the opportunity to listen from some amazing LGBT advocates who will share their stories of how they're bringing the You Equals You message to their community. I'm so excited that we will also have a chance to highlight two amazing You Equal You campaigns that are looking to engage Latinx communities by keeping them safe, keeping them informed, and making sure that they are empowered as they aim to reduce HIV infection among their community. I am so happy that today we're going to have this opportunity to not only learn and be inspired by one another, but to also be connected. Today, before we jump in and we learn about You Equals You with a quick glance, let us jump into our housekeeping rules as we move forward in today's programming. Once again, from the Latino Commission on AIDS and from myself, thank you for joining us. And let's move on to housekeeping before our incredible webinar. Please feel free to ask questions in our comment box. Also, translation services are available from English to Spanish. We also ask that you kindly complete our survey at the end of the webinar. Also, if you need help troubleshooting a technical issue, please send a direct message to Luciano Riberti in our chat box. He is our Community Engagement Director and will be assisting us in today's webinar.
I am here to give you the lowdown on an undetectable viral load.
Facts! A person who is living with HIV and who is receiving effective treatment
cannot transmit the virus to sexual partners.
You equals you.
You equals you.
You equals you.
Undetectable equals untransmittable.
You equals you. My body, my rights.
When I found out about You Equals You, it changed my life. It allowed me to feel normal for the first time in 20-something years.
You equals you.
The first thing I wanted to do was shout it off the rooftops, right? I'm undetectable. I can't transmit the virus.
You equals you. You equals you. You equals you.
You equals you made me realize that I can really live again. But more importantly, I can love myself again.
Science, not stigma. Science, not stigma.
The science really does verify and validate you equals you.
We've reached a point today in 2019 that we know that if we treat a person who's infected with HIV and bring down the virus to below detectable level, not only do we save the life of that person, but we make it almost a fact impossible for that person to transmit.
This huge weight just lifts off your shoulder in terms of just dismantling stigma immediately. Not only this internalized stigma, which is profound for us living with HIV, but also that our partners don't have to be afraid of us.
I think the time for excuses are over. I think it's very, very clear that the risk is zero.
Today, DC becomes one of the first cities in the nation to support new HIV strategy called You Equals You.
That video always gets me a little emotional because it reminds me of how much we have come in adding to the HIV prevention toolbox. So thank you for allowing us to share that video with you. Before we jump into the evolution of U equals U, I know many of us have been taught that in order for us to know where we're going, we need to know where we came from. And so in speaking to our audience today, I'm honored to be able to share with you U equals U at a glance, the evolution of U equals U, which will be summed up with a call to a Latinx mission of how we can play an active role in promoting this amazing toolbox and tool that we have available to our communities everywhere. So let's start off with the history of U equals U and the evolution. In 1996, I think it's really important to highlight that this is the year that highly effective HIV treatment is developed. High active antiviral retro treatment, which we come to know as HAART, means that HIV now becomes a chronic illness and is no longer a death sentence. This is the first time in the history of us knowing HIV that we have a customized combination of a different classes of medications that a doctor or physician can prescribe individually, customized to each person in the community based on factors as the patient's viral load, how much virus is in the blood, the particular strain of the virus, the CD4 cell count, and other considerations. This was a milestone in our journey as we begin to look at PrEP, PEP, and how U equals U will play a vital role in keeping not only viral loads down, but also as it pertains to empowering us in our relationships to come. So in 2016, this is about 10 years after the introduction of heart medications, and we have an announcement by Dr. Julio Montana, who is the pioneer for the concept of treatment as prevention. Dr. Julio Montana is the executive director and physician in chief at the Center for Excellence in HIV/AIDS. He's also the HIV/AIDS program director at St. Paul Hospital, Providence Healthcare. I think it's important to highlight Dr. Montana because of his influence in treatment and prevention. Dr. Montana received his MD with honors in 1979 at the University of Buenos Aires in Argentina. In 1981, he joined the University of British Columbia as a postdoctorate fellow, completed a residency in internal medicine, and from there really dedicated a majority of his life into HIV/AIDS research as we aim to look for a cure. Dr. Montana has authored over 800 scientific publications on HIV/AIDS. He has focused his research in the development of antiviral therapies and management strategies. He has been a pioneer and a Latinx pioneer, may I add. He was also the first to advocate for the expansion of heart coverage to curb the impact of the HIV/AIDS pandemic in terms of decreasing progression to AIDS and death, as well as decreasing HIV transmission, largely through the efforts of TAP, treatment and prevention, which has been implemented with great success. Dr. Montana has received numerous awards for his work in the field. So I just want to take my hat off to the amazing work that he has done within our community. And so we move on now to 2008. This is when Dr. Pietro Vernazza and the Swiss National AIDS Commission are the first to confirm that people living with HIV on effective treatment cannot sexually transmit HIV. This became known as the Swiss Statement. In January 28, the Swiss National AIDS Commission issued a statement for doctors in Switzerland about the safety of HIV treatment to reduce HIV transmission. The document was in French and in German and was known as the Swiss Statement. The main statement was that an HIV positive person on effective HIV treatment cannot transmit HIV through sexual contact. The document was produced because HIV positive people were being criminalized. If they had sex with an HIV positive negative partner, even if the negative partner consented. It was also produced so that heterosexual couples could have children naturally, meaning that if one partner was positive and the other was negative, neither would be faced with legal charges. There was, however, several conditions that were included in the statement. One was that the HIV positive person needs to be good at taking their medications and routinely seeing their doctors, and that the viral load needs to be undetectable for at least 6 months, and that they also have no other sexually transmitted disease. Although scientifically no risk can ever technically be zero, there was little evidence to prove the statement. This risk was compared to the risk of transmitting HIV from kissing. We move on now to 2011. This is actually when the clinical trials of the HPTN-052 reports that the early treatment dramatically reduces the risk of HIV transmission in heterosexual couples within different HIV statuses. This is the year that medical journals are beginning to talk about and are beginning to publish articles around the prevention of HIV-1 infection with early antiviral therapy. It was the time where publications at Science Magazine and the New England Journal of Medicine was looking at this as a promising development towards curbing the infection of HIV, but also in reducing the transmission of HIV within a community at large. This is the year where many of us began to hear the term HIV treatment as prevention. So now let's move on to 2014. 2014 was actually a very active year for the movement and the development of U equals U. It was in 2014 that it was reported that no one with an undetectable viral load, gay or heterosexual, transmitted HIV in the first 2 years of a partner study. The partner study reports that there were no HIV infection after 0 discordant couples had sex without condoms more than 44,000 times. No reports. And when asked what the study tells us about the chances of someone with an undetectable viral load transmitting HIV, presenter and lead author of the study, Alison Rogers, said, "Our best estimate is it's 0. No one with an undetectable viral load, gay or heterosexual, transmitted HIV in the first 2 years of the partner study." The power of U equals U and the evolution really began to take off in 2016, where we began to brainstorm and bring to term U equals U, was led by 2 gentlemen, Gus Cranon and Bruce Richmond. Both of these gentlemen were instrumental in not only branding U equals U and not only being at the forefront of really being able to put a face to what this message can be, were done at the 2016 conference on retroviruses and opportunic infection. Gus, who is a global HIV activist, journalist, and member of the Prevention Access Campaign founding task force. And Bruce Richmond is a Prevention Access Campaign's founding executive director. They both discuss strategies to build a consensus that an undetectable viral load was uninfectious. Gus called this the big secret in the HIV field, while it was being discussed as undetectable equals uninfectious. Gus suggested the catchy slogan, U equals you, which over time and with additional community input became undetectable equals untransmittable, or U equals you. In 2016, U equals U is launched in early 2016 by a group of people living with HIV and global experts, again, to build and promote a consensus about the science of transmission and risk to promote U equals U. It was this time where globally we began to see advocates and community experts and allies in the public health field begin to take notice of the studies that were taking place and also the results that those studies were producing to add, as I would say, credence to the idea that undetectable means untransmittable. Here we have Terrence Higgins in 2016. So if you've noticed, 2016 has been an extremely active year within the U equals U movement. So we're going to talk about a few more milestones within this year before we move further in our glance of its evolution. But I love to point out first and highlight Terrence Higgins, who at the beginning of the Can't Pass It On campaign was at the forefront of issuing the first U equals U statement from an NGO and medical director. And I quote, "We now have the robust data to say with confidence that people living with HIV who are on effective treatment cannot pass on the virus." The first U equals U statement from an NGO and medical director, Terrence Higgins. In 2016, we find that the evolution of the study of the Partner 1 results are published. This is creating excitement and a buzz within the community as reporting zero HIV transmission after more than 58,000 condomless sex acts. This study was conducted among 14 European countries, among 1,166 couples, one of whom was positive and one of whom was on treatment and whom was negative. Of this group, 58,000 sexual acts occurred without condoms, and within that 58,000 acts, there were zero HIV transmissions. The evolution of U equals U 2016 continued to evolve. The HPTN 052 final results are published, which confirms that no participants with an undetectable viral load transmitted HIV to their HIV negative sexual partners during the study. New York, shout out to New York City's Department of Health, becomes the world's first city and health department to endorse U equals U. This is also the year that Dr. Carl Dappenbach and the National Institute of Allergy and Infectious Diseases begins to produce videos to confirm that U equals U and zero risk of transmission are real. Now, as we move forward in our evolution of U equals U from 2017 to 2023 today, I wanted to highlight some significant changes and developments and enhancements to the message of U equals U. Between 2017 and today, the CDC confirmed that U equals U, people living with HIV who are virally suppressed, have effectively no risk of transmitting HIV. Dr. Allison Rogers announces the risk is zero with the results of the Partner 2 study at the International AIDS Conference in Amsterdam, where the final results were published and presented to the greater scientific community. Canada becomes the first country to endorse U equals U in North America. While it's important to highlight that Brazil and the Brazilian government becomes the first in Latin America to include U equals U in updated HIV guidelines. Shout out to Brazil. CDC confirmed that viral suppression is 100% effective for preventing sexual transmission of HIV. So why does the evolution matter? Why is this tool so important within our toolbox as we aim to reduce HIV infections within our community, as we aim to keep our fellow members in our community safe? Why is U equals U important to share with our providers, our medical doctors? Why is it important to share with our infectious disease specialists? Because the science and the numbers don't lie, right? Groundbreaking research shows that people living with HIV report significantly better health outcomes when their healthcare provider informs them about U equals U. It's in the science that if medical providers are aware of this tool in the HIV prevention toolbox, the greater and healthier outcomes are more likely to occur. So it's also about informing people living with HIV about U equals U. Those informed of U equals U by their HCP were significantly more likely to report treatment satisfaction, optimum adherence to treatment, and self-reported viral controls. U equals U was able to empower participants by helping them understand what treatment satisfaction meant, how do you obtain optimum adherence, and how do you take and communicate assertively your viral control to your medical provider. So as we can see, U equals U was also used and can also be used as an empowerment tool within our communities. It's important to understand that as we aim to end the HIV epidemic, as a Latinx community that is not a monolithic community, but a diverse community, it's important that we look at the incredible work that we're doing today and look at how we can enhance that work with the message of U equals U. How can we implement it into our marketing? How can we implement it into our grant writing? How can we implement it into the conversations that we are having with our Latinx LGBT clients every day? I hope that by providing you some of the background and evolution of U equals U, you feel empowered to learn more. I encourage you to please take advantage of the resources that are available to you. Prevention Access Campaign is a perfect example of where you can learn more about the strategies that are in place to promote U equals U. You're able to gain resources and you're able to look and be inspired by the amazing Latinx organizations that have taken U equals U messaging to the next level. I also encourage that you check out the CDC and that you also check out sites within your local community by doing a search of what's available. At the end of today's presentation, we're going to be doing just that. So thank you so much for joining me for the evolution of U equals U and why it matters to our community and keeping our communities safe. So we've talked a little bit about the science, but before we talk about the relationships and how U equals U is empowering communities, Latinx communities, to take control of their health, I would like to give a special shout out to the Prevention Access Campaign, which celebrates 7 years of the U equals U movement. So happy birthday, U equals U. It's important to understand and also really appreciate Prevention Access Campaign for being at the forefront of the movement for U equals U. Just several highlights that the World Health Organization has finally included U equals U in official guidelines on HIV prevention, testing, treatment, service, delivery, and monitoring. Also, the United Nations endorses U equals U and encourages member states to leverage U equals U as a stigma reducing intervention and as a tool. And one last highlight before we move on to some incredible stories is that the U.S. President's emergency plan for AIDS relief includes U equals U education as a minimum requirement of all PEPFAR countries. This is to include Latin American countries, South American countries, and so I encourage my audience members today to take advantage of the information that's out there and also get encouragement and empowerment from the progression of this movement. So as I let you go, I am so happy and thankful that I was able to spend this moment with you. But now let's take a look at how U equals U is affecting communities up close and personal. Our first guest, Everaldo Avicio, is a licensed clinical social worker and public health professional skilled in community organizing, public policy advocacy, and individual family therapy with youth and young adults. Everaldo is an HIV STD strategic implementation specialist at the city of Long Island Beach in California. He comes to us with over 10 plus years of experience in engaging Latinx communities for better health outcomes. Please help me in welcoming Mr. Everaldo Alvicio to be our first guest. Everaldo, thank you so much for joining us for today's conversation around the power of U equals U in the Latinx community. I am so honored to be able to have your time and the ability to really talk to you a little bit about the work that you're doing within your community, and also to learn a little bit about how you have implemented U equals U within the work that you're doing to service Latinx LGBT people in your community. But before we get into that conversation, and I did have an opportunity to read your bio, could you share with the audience a little bit about yourself?
Sorry about that, so sorry.
No worries. A little bit about yourself and the work that you do, and really what motivates you to do the work.
So thank you for having me here, Julio. It's in the work that I've been doing, I've gotten to know some of the amazing conversations the Latino Commission on AIDS has hosted. So it's an honor. So I have started my HIV work. It's both personal and professional. When I came out a while ago, one of the first things my mom, we've come a long way, but one of the first things my mom said is that te vas a morir del SIDA, you're going to die of AIDS. So early on my whole life, I was very much aware of how my identity as a gay man definitely was impacted by HIV and AIDS and how it was spoken about or discussed. So that's me as a young kid, teenager, all the way up to my 20s. Fast forward to today, having something like U equals U as not only as a tool, but as an idea, as an opportunity, I think really has made a lot of strides to folks who both are impacted by HIV, living with HIV, and who are at risk for HIV. So in my work, I work for, I have my own private psychotherapy practice as a licensed clinical social worker, but I also work in public health. And in that space, I lead efforts around HIV and STD reduction in communities that, part of my community that is disproportionately impacted, but you may pretty much well know Latinx, Black, African-American communities. So I think U equals U is a newish concept that has yet to really translate to Spanish-speaking Latinx folks who aren't doing the work every day like I am. So I think that's where someone like me, like a messenger, may come in to move that powerful message forward that really has changed the life of many, including myself. So it's a great tool, and I hope doing something like this can help further that effort.
That's awesome. You mentioned that the U equals U message really hasn't translated as much into the Latino community, or maybe not as much as we would like. Can you talk to me a little bit about how you promote the U equals U message within your work in California?
I think initially it's just about being honest and comfortable and offering a space to be direct about viewing HIV as a health issue and not a socially stigmatized branding, if that makes sense. So I think in my own lived experience as a Latino gay man, but also even just in the conversations I may have outside of HIV work, let's say I'm talking to like a local parent group that worked with youth or Latino youth, or I'm even with a client who is a therapy client who might be in their journey to come out, Spanish-speaking Latino. Every one of those points is at their own level of this journey of acceptance of what it means to talk about HIV, what it means to talk about sex, what it means to think about risk, and if someone is living with HIV, whether it's in a more personal space where, like, if I date someone who's undetectable, or in a more professional space where it's about maybe building someone's ability to maneuver their life living with HIV. Every person has a journey in that. So I'll just give an example. I first experienced really what it would mean to have to live with something like HIV and AIDS when I had a false positive a long time ago. And it was an experience. This was in 2005. So it was an experience where I had to wait a week to get a confirmation it came back negative. But that was kind of, I circled back to the space in my mind where my mom said, you're going to die of HIV, or you're going to die of AIDS, right? So I was like, okay, there it is. But because of that process, 20 years later, and because of my work and because of who I am, I mean, it's a non-issue for me, but it still may be an issue for someone living with it, if that makes sense. So they might be surprised that I'm okay with it, which is new to me, because I think that reflects more about your own journey. Like I've been saying, like, where are you with the fact that you are at risk, or that you may be living with, or that you know someone who is. So we're talking about U equals U right now, but I think in Latino communities, it's really about shining the light on those points of our lives that maybe our parents or their parents weren't able to ever have conversations around. So it's like kind of being the one who breaks the cycle, so to speak, or the one who starts a healthier response to challenging situations, such as someone living with or being at risk for HIV. So yeah, whether it's, and right now we're talking about HIV/AIDS, but whether it's mental health, whether it's substance use, well, all of the above, or even just as you probably experienced, just, oh, tiene el COVID, like even just COVID was like a bad word for, so it's kind of dealing with those uncomfortable feelings you get is I think the first step, that really just acknowledging that that's how you feel. Even when I talk to my parents now, there's like, oh, el muchacho es así. I'm like, ¿cómo, mom? It's like, oh, he's gay. I was like, yeah, he's gay. So it's like even saying that word out loud, it's still a challenge for some folks or for Latino communities in my experience. So I think it's not even, I think before I get to the space of like, okay, let me talk to you about what viral load means and what, medications once a day, like before I even get there, I think I've been more effective just that first step where it's, let's just see where you're at with this. How do you feel about it? Are you totally cool with it? Am I talking to a professional or am I talking to someone who's new to the whole process? And I think because a lot of this work, at least for me, starts from an English language, that already is a challenge, because how do you relay the message, not translate, but really kind of make someone understand what you're trying to say when you say you equals you. I think I read it somewhere in Spanish. Undetectable es intransmitible. So trying to explain that to someone who may not be, high school educated, maybe went to school beyond elementary school or something. So yeah, it just who's in front of you, I think, determines how you're gonna, at least for me, determines how I'm gonna engage with them around the conversation of who equals you.
I so love that. I so love that because when you're talking and you're giving me these descriptions of what it was to engage your mom, right? And to talk about some of these issues, it just reminds me of how empowering the message of you equals you can be.
Yeah.
When it comes to destigmatizing what HIV looks like within the Latinx community. And so to be able to hear you say that and to be able to share that encounter with your mom, I'm sure was a liberating experience every time you have to do it, right? But thinking about being Latinx, being LGBT, and for some of our younger members who are just getting into the work, how would you recommend that they share the message of you equals you? How or where would they start?
I think first initially asking themselves how they feel about what it means to be at risk or living with HIV. Like, what are your thoughts about it? Is it a non-issue? Are you worried about it? I think some things I hear often now, and I hate that I'm dating myself, but yeah, it's like I've been told, oh, you're traumatized. We don't have to worry about it the way you did. You're traumatized because you saw those people dying and you were at risk and you couldn't have sex without condoms. And so there might be that response from a certain age range, but really I think that depends on the particular, I guess to use your category, youth member whom I'm maybe thinking about. But really it's just asking yourself, well, what do you think about HIV and AIDS? Is this something you should even worry about? And then based on that response, it's kind of really being curious about it, okay, I don't think it's a problem. Well, why? And then talk to folks about it. Or, yeah, I worry about it. I really want to engage with it. So asking yourself what has been done, what tools are in place for me to advance the effort even further. So not reinventing anything. And I think the best advice I can give is ask for help. You don't have to do this alone. There's been a lot of work done. And I feel like more often than not, positive and negative reasons, whether it's someone feeling like only they can take on the world and it lies on them, the role, or even sometimes if it's kind of ego driven, like silos get created. And that's when there's 2, 3, 4 individuals, organizations providers doing the same thing and not talking to each other. So I think as a someone from starting in this work, it's being that bridge builder. But that requires a lot of ability to face and deal with conflict and disagreements, and being able to manage your emotional reactions to sometimes heated conversations. So I think once you do all of that, you can talk about anything. You can kind of bring it up and be in any space. And it's really about what I've learned for myself. And I wish I could tell myself at 20, I'm 41 now, is don't worry about knowing everything. Worrying about knowing yourself first, and knowing about what makes you tick, what scares you, what excites you. Center yourself so that no matter what you come across or what you face, it won't destroy you. It'll just make you work, but it won't be the end of it. And that's how I feel like, and nothing I don't think ever really is, unless obviously physically something happens to you. But I feel like so many of us, when we're starting our journeys, our careers, our professions, is there's like this fear of doing something wrong, this fear of like effing up or not doing, or not being part of the group, or kind of standing out on your own. So again, I think that all goes back to what's inside and what you have, and that'll push you through any difficult conversation or situation. And I share all of that because that's what I find when you talk about someone living with HIV, and when you talk about, okay, can I date? Can I be with someone? What does that mean? Is my life forever changed? What does it mean for me physically, emotionally? Who do I tell? Who don't I tell? If you're feeling as a person that's there to help, unsure about it, all of that, that's kind of where you have to start.
Got you. I like that you highlighted knowing yourself. And really understanding who you are and what drives you, especially when you're sharing a message like U equals you, because it can be personal for many folks, especially in our Latinx community, where we all talk about sex or sexual behaviors or taboo sexual behaviors that folks may look at to be taboo. So I'm so glad that you highlighted the fact of being able to know yourself, but also taking into account the person that's in front of you and what is their lived experience, what is the lens in which they see life through, right? And really taking that into account. I think as Latinx providers and advocates, we know our message pretty headstrong. So thank you for highlighting that it's important to know the person that's in front of you, as well as knowing yourself, right? I think that's a big part of destigmatizing or starting to destigmatize HIV and just the conversation of prevention and living sexually healthy, right? So we're wrapping it up for this segment at this moment, and I want to give you an opportunity to leave us, if there's one thing that you can tell your younger self as you was getting into the work, or a message that you would like to give your younger self, what would that message be when it comes to the work?
Yeah, I think don't be afraid is what I wanted to say right away. And what I guess I would tell myself, Everardo, it's okay to not have it all together. It's okay to, excuse the language, but yeah, it's okay to fuck up. It's okay to not have it all together, to not have everything in place. That alone is gonna destroy you. It won't even let you move beyond that. So be kinder to yourself. This is hard work. This is exciting work. It's who you are. It's part of your lived experience. Just as you go forward, just remember that you're not alone, and this is a community. And just reach out and ask for help if you need it.
Everardo, thank you so much for that message and for your time. I do want to let all of our audience members know that I will be making your email available in case folks want to reach out or they have questions. I'm sure we have some California folks that are joining us today. So we'll make sure that we have all of your information available at the end of this particular webinar. And to our audience, if you have a question or comment, please leave it in the box and I will try my best to get to that comment at the end of our webinar. Once again, thank you so much, Everardo, for joining us. I'm the Latino Commission on AIDS. Thank you for the work that you're doing, the advocacy. But most importantly, thank you for your representation as a Latinx leader and as an advocate and as a role model for many of us in the field. We so appreciate your work.
Thank you so much, Julio. It's really been an honor and a pleasure as well.
Absolutely. You have a great one.
You too.
Our next guest is Marco Benjamin, site manager for Waves Ahead in Puerto Rico. Marco Benjamin has been an all-time advocate and consumer advocate for HIV/AIDS in 2007 after being diagnosed with HIV. Marco started his career in grassroots advocacy issues, including pharmaceutical drug pricing, HIV stigma, and condom use in the adult film industry. Currently, Marco continues to bring his heart into everything that he does with his community engagement work and the promotion of U equals U in Puerto Rico. Please help me in welcoming Mr. Marco Benjamin. Nobody else. Thank you so much, Marco, for joining us for the Power of U equals U webinar to talk a little bit about the amazing work that you're doing in Puerto Rico. Just so our audience knows, me and Marco know each other for about the last 10 years. I first met Marco when he was doing HIV activism at the Jacob Javits Center for New York City Pride. So we are super happy to have you here today, Marco. I did read a little bit about your bio prior to you coming on now, but if you can tell us a little bit about yourself and also a little bit about your organization and what made you get into the work that you're doing today.
Yes, thank you for having me, Julio. Currently, I'm working in Maunabo, Puerto Rico with an organization that's called Waves Ahead, which is an LGBTQ identified organization that supports older adults and the LGBT community in Maunabo, Puerto Rico, Cabo Rojo, Isabela, San Juan, and also in Loíza. It's been an honor to be able to work with such a grassroots organization here on the island that's really providing support to older adults. The landscape in Puerto Rico is very different, particularly where I live in. It's a very small local community, about 10,000 people live here, and it's really an older population. So it's really great to be able to work with folks on the ground here that's really working in rural areas across the island to provide HIV prevention and tools to folks in the community.
I love that. I love that. Can you talk a little bit about why you got into the field or what motivates you to do this work?
Yeah, sure. So I got motivated doing this work about, I think it's about 10, 12 years ago when I identified as HIV positive. It was an opportunity for me to utilize my voice to really create an effective change, right? Growing up in a small neighborhood in New Brunswick in New Jersey, there really wasn't, HIV prevention messaging, as we have it or as we know today. It's on bus stops, it's in magazines, it's on commercials. Many years ago, in the neighborhood that I lived in, it just didn't really have some of that messaging. So I wanted to use myself to really help create and change that landscape and try to educate folks. I created a t-shirt that said, "This is what HIV looks like," and walked all over New York City and New Jersey, rode buses and trains to try to, just bring a conversation, just a real conversation around HIV and sexual health. And so I was able to participate in many activism works or initiatives around discrimination, and also drug pricing, which is very important. You know, that drugs are very high priced right now, and sometimes often provides barriers and gaps for people to get, you know, excellent care, if you would. And then working in a very, you know, for-profit corporate, you know, Fortune for corporate America, and looking at ways to really, you know, help communities in a different table and in a different, you know, atmosphere around HIV education. Yeah.
Wait, I remember when we first met. The first time I met you, you had a T-shirt on that said, "This is what HIV looks like." And I remember when I saw that, it took me a little bit aback because even as an HIV advocate and a provider, I never saw anyone who boldly wore their status. And I admired you, but I was also, I just thought of how brave you were to be able to do that. Can you tell me, as we talk about U equals U today, right? Undetectable equals untransmittable. It's a tool that we have in the HIV prevention toolbox. Can you talk to me about how you utilize the U equals U message in the work that you're doing in Puerto Rico and with just the Latinx LGBT community in general?
So I think it's important to, you know, harness the U equals U initiative to really, you know, reduce stigma within a community that, you know, there's a lot of stigma around HIV, you know, in all communities and all across the country and the world. And I think that, you know, harnessing such a great initiative to really bring education and also awareness around, you know, folks who are undetectable will not transmit the virus to partners or to other folks. It's been effective with many other, you know, disease, you know, that are out there today, cancer and sickle cell, and there's a lot of, you know, ways that they're marketing that. And so I think that if folks are able to, you know, government and for-profits and not just nonprofits, you know, that are on the ground, you know, really being the warriors in the face of this initiative, if more folks got together, you know, to really promote this, it would really, you know, reduce stigmas within many communities.
Do you find that it's, in the work that you're doing in Puerto Rico with our Latinx community, do you find that it's easier for people to talk about HIV today within the LGBT community?
I think having conversations around HIV today is a lot different, right? And even here, you know, in Puerto Rico, it's different than the United States, where there's less education, right? There's less resources. You know, folks from rural areas have to go to the metropolitan area to go get care. But I think that there are conversations that are happening, you know, across the island, which is trying to bring up HIV more. You know, instead of sitting, you know, within a round table as we did and as we continue to do, utilizing other platforms like social media and other opportunities to educate more folks, it helps. In short, it helps reduce the stigma, right? Folks aren't dying as we once were. You know, there's new tools inside the toolbox that's allowing folks living with HIV to live longer, and also folks who are HIV negative to not contract HIV as well. So, yeah, it is working.
Absolutely, I love that. So you represent or you work with an organization in Puerto Rico called WAVE. Am I correct? Or WAVE Ahead?
Waves Ahead, right? Which is a nonprofit.
Awesome. Can you talk a little bit about the work that you're doing specifically at WAVE Ahead? And is there a message that you want to kind of like share with our audience about what's happening in Puerto Rico in regards to the work?
So the work that we're doing at Waves Ahead across the island is again, really supporting older adults in the LGBTQ community, providing mental health services, providing food for folks to have something healthy to eat. The cost of food is very high, you know, and it's very expensive, just not only here, but just anywhere else. So having, you know, some resources to fill in those gaps is definitely important here. You know, we can find better tools and better access to care for people living with HIV with your help.
Thank you so much, Marco, for being my guest today and just giving me a little bit of a highlight of the work that's being done in Puerto Rico, but also about the work that you're doing as a representative, being Latino, being queer, being HIV positive. I commend you for just being that advocate, that voice, and that face. Many times within the Latin community, LGBT community, or many other communities, there's stigma that's always associated with living and thriving with HIV, but you've been able to put a face to that. And so I want to thank you for your time today. I want to thank also WAVE for the amazing work that they're doing and for having you in Puerto Rico. And just from our audience members, if there's any way you want to get involved in Puerto Rico with any initiatives, Marco Benjamin is one of our primary contacts on the island, and we will also be sharing his information at the end of this particular webinar. Thank you so much, Marco, for joining us. I'm so happy you was able to spend some moments with us and just share a little bit about yourself. Thank you, and I'll see you soon.
Thank you, bye.
Thank you so much, Everardo and Marco, for sharing your stories and a little bit of your insight around what you are doing with U equals U in your communities. We are so grateful that you were able to share some of that wisdom with us today. This will conclude our webinar on the power of U equals U. I'm so happy that we were able today to explore the evolution of U equals U and its movement. I'm also glad that we were able to bring together Latinx queer individuals who are creating strides in their community by utilizing this message to provide that much more when it comes to public health and public health engagement. We are so proud that we have this added tool to our HIV prevention toolbox, and so happy that we can highlight some of its successes today. Thank you so much for joining us once again from the Latino Commission on AIDS. Please know that you will be provided with a list of resources, Latinx U equal U programs and campaigns that we hope will inspire you to create change in your community, but also to connect with other Latinx community members who are doing some really important work. We also hope that we were able to answer everyone's questions during the session in the chat box. If we were not able to get to your question, please know that we're also going to be providing my email and our two speakers' emails at the ending of this session. Please feel free to reach out to me if you have any questions about U equals U or any type of resources that you may be looking for. We are so excited to have you as a part of today's webinar, and we wish you well in your journey to promoting U equals U in your community. Thank you so much from the Latino Commission on AIDS.